Let's now talk about gallbladder 5, Xuanlu, a point of the eye system. GB5 is located at the junction of the second and third quarter of an imaginary line connecting stomach 8 and GB7. How to find? First, locate the two reference points. Stomach 8, which is 4.5 tsun lateral to the midline and 0.5 tsun within the anterior hairline at the corner of the forehead, and GB7 in the depression on the level of the apex of the ear within the circumauricular temporal hairline. Then divide the slightly curved line between these 2 points into quarters and locate GB5 at the junction of the upper 2 quarters with the lower 2 quarters. Generally, this point is located on the level of the parietal suture just within the hairline. Needling is 0.3 to 1.5 tsun transversely or subcutaneously along the skull in the direction of the occiput or towards the disorder or pain. Actions, indications, expels wind and heat, opens the channel. Special feature, meeting point with the TB, LI, and stomach channels. GB5 subdues liver yang, so it's good for headache, dizziness, blurred vision, extinguishes interior wind for convulsions, lockjaw, aphasia. GB5 is used for interior wind causing convulsions, spasticity, and aphasia. Apart from this, it is an important local point for temporal headaches from liver yang rising. GB5 belongs to the temporal group of points of the eye system, and it is the most important of this group as it is in direct communication with the brain. It should be needled horizontally, that is, at a 15-degree angle towards the back of the head. This is good for one-sided headache extending to the outer canthus, pain of the outer canthus, headache, toothache, pain, swelling, and redness of the skin of the face, nosebleed, incessant turbid nasal discharge, rhinitis, febrile disease with agitation, and fullness and absence of sweating. For one-sided headache, we combine GB5 with GB4 according to 100 symptoms. GB5 is crossing point of GB, TH, stomach, and LI, helpful for dizziness, one-sided headache, cerebral weakness, and congestion. Consider for a lack of determination to see a plan through or for a lack of coordinated movement or speech. Smooth coordination and flow of all faculties of body, mind, and spirit are part of the roles of the liver and gallbladder. As the official for judgment and decisions, immense stress is placed on the gallbladder to facilitate all the timing and transactions within the body, mind, and spirit. Imbalance here may be shown as clumsiness, an inability to negotiate one's environment, inability to grow, develop, and execute a plan, whether for a simple journey or one's life. This point is used for disturbance of movement, lack of coordination, or lack of determination to proceed with one's plan. Without this smooth facilitation, anger, frustration, or resignation may cloud the spirit and thwart the potential of the person. GB5 is close to the motor area of the brain, and this point is useful after wind stroke. This point activates the meridian and can be used when there is cerebral weakness and congestion. GB5 is a crossing point within the yang ming. The stomach is the origin of fluids, and the large intestine absorbs and eliminates fluids. This crossing point is useful for facial swelling with or without redness or heat, toothache, nasal discharge, rhinitis, and nosebleed. Locally, it relieves pain and can be used for toothache and headache, disperses swelling. GB5 expels wind and clears heat, and so can be used for migraine, especially one-sided, deafness, epilepsy, pain in the outer canthus. It is also useful when there is fever with vexation and fullness, that is, agitation and fullness with absence of sweating, and can affect both the Xiaoyang and the Yangming meridians.